All right, one more minute before we start.
I see Brazil. I see so many friends. Sue Troutman, Sue Knox, our faithful friends.
And Zainab from Turkey.
Oh, great.
All right. Well, there's too many to.
Yeah, we can't say hello to everyone, but.
No, but I think we've got Bali here.
Wow.
Yeah. Anyway, thank you everyone for making the time to join us. All right, just a couple more seconds and then we'll launch. Oh, Trinidad and Tobago, if you look at the chat room, you'll see, wow, Dominican Republic, Montreal, Canada, Philippines, Buenos Aires, Florida. I hope you guys are okay there. All right, North Vancouver, Cornwall, Ottawa. Oh, wow, this is so great. Sydney. All right, a shout out to everybody. Thank you. South Africa, Singapore, Brazil. All right, I might not have mentioned everybody, but it's so nice to have everybody join us. Okay, well, on my clock, it's time to launch our Treatment Tuesday webinar for today. And I just want to thank everybody for joining us. And I want to thank Southpaw for sponsoring these webinars and for the Classy team as well for helping us put all this together. And of course, we're very pleased to moderate these webinars and with the focus on evidence-based intervention. And, you know, I think we've got an exciting discussion here today. I think that's about it. Let's go on to our guests.
Okay, well, I am really happy to be able to introduce our panel for this evening. Before we get to our speakers, I do just want to mention Mark Hamilton, who's with us from Southpaw. Would you like to just say hello, Mark? And
hello, everybody.
We so
just a spectator.
But we so appreciate your support. You're much more than a spectator. You've been so such a great collaborator with our therapy community, and we really appreciate everything that you do and that Southpaw does to make our work easier. So thank you so much. So I'm really happy to introduce Aparna Guttary, who has been an occupational therapist for more than 20 years. It's a little hard to believe. We sometimes feel so much older, but it's just great to have you here with us, Aparna. She's an occupational therapist with her training from USC, and she has recently developed a patent pending sensory backpack that incorporates a variety of calming sensations to promote self-regulation. You can see the link if you'd like to take a look at that. It's always so great to have so many creative minds in our community. And she is the co-director of a private practice here in California, Irvine Therapy Services. So welcome, Aparna, and thank you so much for being on our panel tonight.
Thank you.
And tonight or this morning or whatever time it is for you around the world, I know it's almost tonight for us. And then our good friend and family member, Richard Purvish. So Richard has over 40 years of experience in pediatric occupational therapy with a long history of helping children and families, especially in the area of autism. He currently is a practitioner at Sky Pediatrics, also here in California. And in addition to his occupational therapy degree, he has a master's degree in child and family studies and some background in psychology, which won't surprise you when you hear from Richard, and we get to share his really wonderful knowledge as well as just his approach. I think everyone is so appreciative, Richard, of your wonderful, calm approach to helping us all know how to be better therapists. And then certainly not least, but our very good friend and colleague, Dr. Roseanne Shaw. Roseanne,
Everybody.
here. So I think many of you know Dr. Shaw from her really instrumental research. She's been such an incredible leader for us in receiving funding and executing really important studies that have led us to this point where we have air sensory integration recognized as an evidence-based practice. So she's just been so important to the field. And Roseanne is the director of the Jefferson Autism Center of Excellence and a professor at Thomas Jefferson University. We are just so lucky to call her a friend and a mentor and a colleague. So this is just a great panel. Welcome to all of you, and let's get started.
All right.
One more thing. If you have questions, look at that. We have over 200 people joining us. Thank you all for being here. It would be great if you will put your questions in. There's a Q&A option on your screen. So that would be great if you can put your questions there or put them in the chat box. We'll try to track both and we'll have some time for questions at the end.
And I just want to say, we hope that most of you can join us all the way till the end, because we will have another raffle. Southpaw's been very generous as well as classy, so we're excited about that. But we'll stop here and we're going to turn it over to Richard and Aparna.
All right, well, hopefully I can do the technology. So let's see if I get my screen up and sharing. Is that working?
It's working perfectly. Well done.
Great. Well, then let's get started. And I do it a little bit differently. So I'm going to actually do the thank you and acknowledgements kind of at the start. So we wanted to thank Classy for inviting us to come and present, and for Southpaw for their support in organizing this series. We want to thank our friends, our families, our mentors, and our special friend, ASI Theory. So at the start, I'm going to talk a little bit about how we do what we do when using an ASI frame of reference. And then I'll present some of the case, I'll present one case, and then Parn is going to talk about the key points and examples of scaffolding treatment through the use of equipment and the therapeutic use of self. Okay, so the purpose of the presentation, really what we'd like to be able to do is share and support the development of our clinical reasoning and our organizational skills. We want to be able to provide practical suggestions for organizing our own behavior as therapists when presented with challenges, and provide practical examples of how to scaffold the environment to promote that self-regulation. And in terms of what really at the end of the day, what we really have to realize is that we as therapists are the most important factor in terms of the treatment of the kids we see and their progress. So I did want to point, just make a quick point of clarification. Our colleagues in the UK are sharing a perspective that in terms of the title of the presentation, that challenging behavior may not be the best in terms of recognizing that it isn't always originating with the kids. In many ways, we have to face our challenges as therapists, and that in terms of really what we're looking at is that the challenges are with us and not necessarily with the children, because we as therapists have to facilitate and integrate the needs of our clients and the kids in a collaborative, supportive, and understanding manner. So when I think about challenging behavior, I think it's more of how do I adapt myself as a therapist in order to meet the needs of the kids. So I just wanted to throw that out there in terms of a clarification in terms of how I am viewing the title. So that being said, I'd suggest that ASI is probably one of the best approaches to facilitate building the trust and the personal relationships that we need to to build with our kids and our clients and our families. So how do we do what we do as therapists using an ASI approach? Well, I'm going to go back to the fidelity measure. Hopefully many of you are familiar with the fidelity measure. And really the biggest thing is we need to establish a therapeutic alliance. And we need to create safe environments. We have to ensure the physical safety of our clients. And we have to present the sensory opportunities in terms of being able to facilitate their participation and engagement with our clients. So, one of the ways that we do that is we need to collaborate with our clients in the activity choices. We have to ensure that the activities are successful, and we tailor the activities so that we can just present that just right challenge. So not too tough, not too simple, but enough to invest our clients in terms of what we're doing and really to present it in a way that's fun and engaging. So we're going to challenge their posture. We're going to challenge ocular, oral, and or bilateral motor coordination and control. We're going to challenge praxis and the organization of behavior. And a big part in terms, I think, the kids that we work with that challenge us is being able to support their sensory modulation in order to attain and maintain that regulated state so that they can engage and play and interact with us and with their family and with their peers. So, and a big part of that is developing and supporting the child's intrinsic motivation to play. Now, in order to do that, we've got to figure out, sorry, our light keeps going on and off. It has some lighting issues. So in order to do that, we have to organize our style of treatment. And in organizing our style of treatment, we also have to know our strengths, and we also have to know what our weaknesses are in terms of how we treat and the types of kids that we treat. Now, in terms of using all of this, it's really about clinical reasoning. So in terms of clinical reasoning, it's a way of perceiving. It's okay, we have to figure out the strengths, the needs, the personality, the likes and the dislikes. What do the kids pay attention to? What do they ignore? And how do we form that conception of who the client is as a person? So I'm taking clinical reasoning and applying it in a little bit different way, because I think we have to really understand who the client is as a person. And in understanding them as a person, we can form that therapeutic alliance with them to provide that support and to provide the trust that needs to be established. So, and establishing that therapeutic alliance can be challenging to us with all the kids that we work with, but I think it can be especially challenging to establish this for new therapists and for kids who present us with atypical communication skills and how they decide to express their preferences of their likes and their dislikes. I do work with a lot of kids who are not verbal. So a lot of the kids are nonverbal. Some do use communication devices, but a lot are using gestures and so on like that. So I need to adapt and be able to figure out, how do I establish communication so that both that they understand me, but more importantly, how do I establish the communication so that I understand what they want and what they're saying? So I am going to present a case example, and I would like for you guys to think about this case example, both as a therapist and about who you are as a person. And I want you to think about, okay, how do you form a conception of who this person is? And I know that this is going to be really kind of a snapshot of Joey, that's his name. But I also want you to pay attention to how you're feeling. What's your visceral reaction to the information that I present to you? So here's the referring, excuse me, the referring information on Joey. He attends a moderate to severe classroom with the 1-to-1 aid. He's, I forgot the age, but he's 18 years old. He stands 6 feet tall. He's about 180 pounds, so he's a big guy. He's got profound speech and language deficits. Social communication is an issue. He's got self-injurious behaviors that include biting. He does have scars on the back of his hand. He also bites his arm. He has scars on his arms. So he's got bruising on his head, on the side of his head, because he pushes on it so hard. He does have food allergy. He has eczema. When the eczema flares up, he's going to pick and rub on the eczema, which makes it much worse for him. He's got difficulty with attention. He's got difficulty with impulse control, executive functioning, and again, the fine motor things that we probably always see in terms of difficulty with handwriting. So this was the referring information. These are his SIP scores. Now, this is indicative of from fairly significant sensory processing issues. And I will tell you that in terms of many of the kids that I see, or young adults, this is not an unusual graph for me to see in terms of the evaluation results. So, you know, regardless of the evaluation results, I've got to take that and I've got to form a picture of who this person is. Now, we all, you know, in terms of what we look at, we're looking at, again, the functioning within the family, within the home, within the school. I will tell you that he is school funded. So some of the goals that we see here are going to be directed in terms of school functioning. And the way I think about it, I like to prioritize the goals in terms of, okay, I want to look at safety. I want to look at social interaction. I want to look at praxis. So I'm not going to go through all of them, but I'm looking at self-regulation to reduce his self-injurious behaviors, being able to sequence multi-step tasks, the bilateral coordination. I want to look at organization of the tasks and materials within his classroom so we can look at improving his independence. And again, looking at visual motor skills. So, you know, in terms of looking at that, this case is, you know, I presented it very quickly because what we have is the referring information. We have the SIP scores. You saw some of the goals that we presented. Now you have to think about, how do I organize myself as a therapist, and how do I organize the environment to promote self-regulation, active engagement, safety, and praxis. And we do that in terms of teaching and facilitating through Joey's strengths. So that's the challenge to us as therapists when we use ASI. We have to figure out, how can we do this based on the knowledge that we have. So as we go through, I want you to remember that how we form the view is based on, you know, our influences that we have in terms of our background, the questions that we ask, how we collect the data, and then what the conclusions are in terms of that data. So the biggest thing is looking at this perspective. If we can form that view, and then we can ask these questions as we go, it helps to clarify who our perception of this person is. So as we go through it, if you could kind of take and think about Joey, but also the kids that you work with, and how do you reflect on those kids and being able to adapt the activities so the child is challenged yet successful? Do we teach through the child's strengths? Do I understand what and why they're selecting certain activity, and how do I facilitate that engagement in those activities? And then really, how do we recognize when the child starts to become disorganized, and how to change the trajectory of treatment to reorganize them and to kind of save the session and bring them back into active participation. I ask myself a lot of these questions and many, many more questions as I'm doing a session. And, in terms of seeking clarity, when I start trying to figure out these questions and the answers, it helps to organize myself. It helps to organize how I start my treatment, where I go next in my treatment. And it really helps me clarify what my strengths are and also the things that I need to work on. So a lot of the things that we do, we have to kind of assess and treat at the same time. And I just wanted to, as an aside, just to kind of throw out a quote from one of my mentors, Reggie Bain. She really did help me kind of figure out that I shouldn't feel too badly when I didn't quite know what to do in my sessions, because she kind of gave me a quote that she says. She goes, "If it works, it's treatment. If it doesn't work, it's assessment." And I like that, because as we treat, as we move through our sessions, even in the most challenging of times, we're gathering information, we're evaluating, we're really looking at, okay, what's going on here and what is this child telling me through their behavior, what they present to me, and how am I going to help facilitate them in a more positive direction. So everything is going to work together in terms of what it is that we're going to do and how we evaluate. So I'm going to do one more slide, and then Aparna will take over. So I do have to say, I know that there's a little bit of a disconnect in terms of the name of the slide or the name of the article. It was published in 1984, and I'm sure today that there would be a different title in terms of the article's presentation. But the reason I'm including this article is that this is one of the articles that really influenced me to think and perceive about the kids I work with in a very different way. Donlin was really one of the first persons to talk about what we needed to understand, that we needed to understand the why of what the kids were doing, and that what was the communicative intent behind it, of those challenging behaviors. So, and in so doing, once we understand the communicative intent, we can help form a better way to express themselves that was maybe a little bit less challenging to us as therapists. And that could maybe in terms of social interactions would also be of benefit to them in improving their social behavior. So as I'm working through and I'm watching and I'm working with the kids and things are starting to happen and it doesn't seem to be working as well as maybe in the past, I've got to decide, okay, what are these kids telling me? And I have to kind of go through a list in my head, because there's lots of different things that it could be. And part of it could be, okay, is there a medical issue going on with that child that day? Is there something unrecognized that is happening and that's causing the distress for the child? Is it the receptive language? Are they having difficulty understanding what I'm asking them to do? Is there, the anxiety, frustration that can also interfere in terms of expressive language with the kids? Am I giving them a task or an activity that really doesn't interest them? It's not motivating to them. And if I am, that's me. I need to change that to really start to facilitate more motivation and engagement. Are there conditions within the environment that are bothering them? Do they have sensory sensitivities that I'm not recognizing and is interfering with their performance? Am I grading the task too easy, or too hard? I will tell you that many times I have come up with these great and wonderful ideas and using the equipment, and I think, oh, this is going to be great. And I have 4 or 5 kids and it just doesn't work with them. And then I actually try it and I'm like, man, this is much harder than I thought it was. It looks a lot easier. So, you know, if you're running into kids that are having difficulty with what you've set up, try it yourself, because you might be surprised that what looks easy is much more difficult than it is. So the other thing that I think Reggie talked about that I remembered, she said a therapy session is like a dance. You know, the therapist leads, sometimes the child leads. And when it really works, you can't tell who's leading and who's following. It just works. So that's what we need to be able to develop within our kids, that we have a give and take as to who leads and who follows. And with some of the tasks, you know, if we use a high demand in terms of posture, then if we need to make sure that the task itself is relatively simple in terms of the demands, in terms of their attention. If it's a low demand on the posture, then we can increase the demands in terms of the bilateral and so on like that. And the other thing I mentioned a little bit earlier is that we have to take into, are there stressors in their family life, in their school life? Did something happen that day that really is throwing them off? And is there anxiety? You know, is that causing greater anxiety? I will say that many times I've had kids come in who've had a really, really horrible day at school, and I've got to meet them where they are. I have got to change what I thought we would do that day. I've got to bring them back to a regulated state so that they can then kind of calm down and just really essentially decompress from their day. And that may be the only thing that I accomplish for that day. But you know, if I can accomplish that with that child and they leave and the rest of the family's day is significantly better, then that's a significant impact that I had with that child for that day. So it's not always about goals. It's about meeting the child where they are and then facilitating that improvement over time. So in terms of what we need to do, you know, we have to remember that we work a lot, we as in the kids I work with, a lot at the self-regulation level. And in terms of working at that self-regulation level, I've got to be able to establish the rapport and the trust, and my ability to understand what that child is telling me through their actions. And I can't necessarily take it personally. I have to remember that they are trying to tell me something and I have to be able to figure it out. And then we need to improve how we communicate on a reciprocal basis. So not only do I have to figure out what they're telling me, I also have to figure out the best way to communicate what I would like to see. So that's kind of my my presentation. Aparna is going to take over now, and then she's going to discuss using ASI, the frame of reference, and how it can help us guide treatment.
Wonderful. Thank you, Richard. So I think the themes of both of our presentations definitely intertwine. So using your frame of reference to guide treatment. So understanding that your frame of reference will help you organize your clinical reasoning and your responses in challenging situations or moments. When using sensory integration theory, we are really focusing on adaptive responses from our clients. So in a challenging situation, our goal for an adaptive response may be supporting their regulation and their readiness to interact. I love this chart. This chart is a wonderful chart and visual representation created by Suzanne Smith-Raleigh. And it helps to organize our areas of focus. But what I love about it is it highlights our own therapeutic adjustments that we make for to obtain those positive therapeutic outcomes from our clients. So when working with our kids, you know, recognizing that there may be sessions where we're spending a lot of time in the foundational areas of arousal and sensory modulation and sensory discrimination. in order to support that more optimal engagement and regulation and active joint attention. And also thinking about this as a pathway to really establishing those meaningful connections, the therapeutic alliance, to then be able to transition to more higher level performance skills and praxis when they are more regulated and ready to engage. And that these areas of focus do not necessarily follow a linear path. I loved Richard's analogy of the dance. I think similar to the dance with the child and the reciprocal back and forth, it's also our own clinical dance and reasoning in those moments where we're focusing on and supporting arousal and they're in a good place, and then we can move on to some, place more demands, increase the level of demands to address praxis and skills, and then something may happen that might trigger some dysregulation, and so having to come back to support arousal. And doing that back and forth dance and recognizing that that child needs to be in a place where they're ready to learn and participate, and supporting those needs. And on some days, honestly, it might feel like they're more on days where a child's ready to go and we're targeting lots and lots of goals and lots of areas. And there might be other days where our emphasis is really supporting that arousal and regulation. So kind of keeping in mind that we have to be flexible with our own approach. Oops. Okay, so the next slide, co-regulation and supporting optimal arousal. So the first point is finding common ground. So what I'm referring to with that language is really understanding the interests and the intrinsic drive of the child we're working with and embedding this into our sessions. So this can help with facilitating more active engagement and play. We can immerse them in an imaginary world filled with their favorite characters or favorite songs or stories or toys of high interest, and incorporate this into our therapeutic activities to help catch and sustain their attention for participating. The second point is to promote flexibility. We must model flexibility. So we must be adaptable with our own plans to support a child's needs, and really understanding that a child may or may not be in the optimal place to participate in our planned activities for that day. It's really important to seize therapeutic moments by waiting and watching and listening and slowing things down in moments to be able to learn what our client needs when they need it. And that every day is a new day, and they might just, as Richard mentioned before, the examples of coming off of a very stressful day, they just might need more support on that foundational level. The next area of therapeutic use of self. So I just wanted to highlight and reinforce, never underestimate your connection and ability to understand your client from a foundational perspective. So use that knowledge of what is calming to them, how you can help them co-regulate when they're unable to regulate on their own. You yourself can model calm behavior, taking deep breaths, lowering your voice, speaking slowly and calmly, being empathetic to their experience, because after all, as Richard pointed out earlier, behavior is communication. So the child is communicating something to us, that something is wrong or feels aversive, or that he or she might be working through a really big emotion in that moment. What we can do to help and support with terms of the physical space is we can diminish stimuli from the environment. We can dim lights. We could use a whisper voice. We can actually give them physical space to help them regroup. And once they start to calm and regroup, I really like to narrate what I see. And I use language such as, your body looks more relaxed and calm, or I think, turning down the lights and giving you space, help you work through that. Or I'm so proud of you that you were able to calm and soothe yourself. And the hope is that narrated feedback may help a child to develop those associations over time so that they start to recognize what helps them to regroup and to regulate, and that hopefully this can be generalized across environments. And then supporting that co-regulation, really being mindful of introducing holding to help keep that positive momentum and to help ensure their success for the rest of the session. All right, being proactive versus reactive. So beginning to understand a child's triggers and to help develop proactive strategies to address them. It can be so helpful to use the power of clinical observation to identify and better understand what these triggers may be. So observe a child's arousal from the very beginning of the session. Is he or she ready to go? Are they tired? Are they not feeling well? And that information will guide you to select the very first activity that you introduce in your session and can help set the trajectory of the rest of the session. And when there is a trigger or an escalation, really understanding what the antecedent was. Was it sensory based? Was it an aversive response to stimuli? Was the challenge itself too overwhelming or frustrating? And this will help you start to paint a valuable information to help problem solve through those moments. Planning out transitions. So create a plan for your child to prepare for less preferred transitions or events. Be sure to incorporate and be mindful to be using a lot of proactive calming opportunities throughout your session, ending with calming stimuli to help your child cope and change and shift throughout the session to different activities, and the final transition at the end. Preparing the space prior to the client session. So I like to refer to this as setting the stage. So create a therapeutic space and environment that's based not just on your goals, but upon your child's sensory preferences, as well as piggybacking off of previous sessions of activities that they really enjoyed or were really regulating for them. And maybe starting with those types of activities to help them build that positive momentum, and then adding the just right challenges and novelty along the way. And this is in efforts to help to not overwhelm your client and allow them to be an active participant and engaged in your therapeutic activities that you planned and set up. Oops, sorry. Okay. Using space and therapeutic equipment to support co-regulation. So kind of going back, I think a lot of this ends up repeating itself, but using knowledge of your client's sensory preferences and aversions to promote the optimal regulation using your space itself. So setting up the space to be conducive to your child's sensory needs. So we're using our therapeutic equipment to create these just right challenges, and we're providing them with sensory enriched experiences and giving them motor planning opportunities. And with equipment, as you use it in novel and new ways, you're also helping to address and promote ideation. You can use your therapeutic spaces for children when they're feeling overwhelmed. So kind of creating like a calming corner where it's a place where a child can go to retreat and regroup when they're feeling a bit overwhelmed or overstimulated. And I like this concept too, because I think it helps over time for a child to build the foundations for self-regulation that they're starting to recognize when they're feeling overwhelmed, and self-initiating those spaces as needed. And so you can give them fun names. And I think the bigger piece of it too, as OTs, that we have these resources in our clinic, but how can we help support families at home with regulation? So creating these spaces that can be replicated in the home setting, and working with our parents to create these regulating spaces at home, teaching them that it's not meant to be punitive or timeouts, but rather spaces that are safe and effective where a child can regroup and reset. And so sharing all that clinical information that you're seeing within your sessions and being able to generalize that into the home setting. Okay, now we're gonna have some fun with some visuals. So these pictures are a series of pictures that were taken at Centerpoint for Children, a wonderful clinic owned by Dr. Asia Rowley. And I have these pictures here to show some unique and different ways that you can use and combine equipment to create calming spaces to help with regulation. So this picture is a fun one. This is a really smart creation by a client of mine who turned the Southpaw tire swing into a mega swing. So he needed to motor plan how to keep these tires from separating so he could relax inside without slipping through the tires. So you can see the daisy chain in the corner on the mat there. So we had to figure out, how am I going to tie these daisy chains to get these tires to stay, and all the motor planning and fine motor needed for that. And of course, he ended with the cherry on top and put the pillow inside, and it just really transformed into a little cocoon-like space for him. So that's kind of a fun example of a calming and regulating space. So this next one is an example of a calming spot that a child could burrow inside. So you can see the sheets and coverings. It helps to diminish the visual and the auditory stimuli from the environment. You can also incorporate lots of opportunities for deep pressure by putting pillows and blankets and bolsters and other equipment inside this space. So you're addressing motor planning, not just to construct it, but also figuring out how you're going to enter it, how you're going to exit it, how you're going to maneuver through. So it can be really fun and interactive and calming and supportive at the same time. So I wanted to note that many of the pieces of equipment used in these pictures are actually various pieces of Southpaw equipment, but they're used in unique and different ways. This is an example of building a tire stack inside of a ball pit, so a child can get that extra tactile input while they're hanging out inside. And you can add blankets and pillows, and again, increasing that comfort, making it a really tight enclosed space. And what's nice about this is I like that we can add that tactile support with it serving to be more calming versus alerting and stimulating that tactile can sometimes be. All right, so this is the Southpaw Lycra swing. And so the child would lie inside and you'd put pillows on top and all kinds of objects. But I also selected this picture because I really wanted to emphasize that these calming opportunities can be very play-based as well. So this is an example where we transformed the Lycra into a washing machine and washing all the things inside, including my client, and swinging it back and forth and kind of emulating the water swishing inside of a washer. So really being mindful of this can be playful, and you can tap into imagination and ideation and still be able to provide this supportive, calming input. All right. This picture captures how we can use vestibular opportunities to provide calming input as well. So my client for this one transformed the Southpaw platform swing into a flying tent where he could go inside and relax and get ready for some adventures. So you can be really creative of how you use and adapt equipment, suspended equipment, use it in novel ways that support regulation and inhibition when a child needs it. And lastly, this is an example of showing how children can be very much an active participant in creating these areas that are regulating and comforting. So this is a ultimate fort that my friend built, but you think about all of the heavy work and motor planning that's involved here. So he's needing to transport the equipment from one side of the room to the other. He's having to organize his space. He's having to problem solve the construction. And what I love about this is that when a child settled inside these enclosed spaces, it actually becomes a wonderful opportunity to target skills that maybe are more precision based. So you can target some puzzles or writing, but because you're in this enclosed space and you've eliminated extraneous stimuli from the environment, it might help to help facilitate their attention and their active engagement with those types of activities. And then I think Richard has a fun picture to share too.
Yeah, so sorry about that. My computer was about to shut off. So, you know, I, as I said, I work with some of the older guys and some of the bigger guys. And if you see on the picture on the left there, I kind of have to adapt some things at times to, because they're so big. This is a plinth table from a treatment table, and the legs are just removed. And I've got it on top of the tire swing. And that allows my guys to kind of stretch out and lay down full length. I also use it on the platform swing, and that works really well on the platform swing. And it allows these guys to kind of really kind of relax and enjoy this. I have had so many of my guys that once they get on this and lay down and we do some linear, they just kind of just chill out. So I don't know, maybe Mark, you might want to come up with an idea for something for the bigger guys that might work just as well as that. And on the right, this is the flexion swing. So, you know, a lot of times we kind of have to increase the intensity of the input that we provide. And that's also very true for in terms of the older guys. And so here, you know, we do the flexion swing, but then I'll stop it, you know, kind of at its height and let the kids hang out and get a little bit more intensity. And then we'll, you know, it's kind of varying the speed and the height as we go. So these were just a couple slides that I wanted to show just in terms of the equipment. The other thing that I really like is the trampoline, and you'll see that in a minute. So what it really comes down to is we have to figure out really what's the best good for the person that we're working with. And I wanted to go back to that statement that what we believe is possible is extremely important to our effectiveness and our clients' growth. And I'm going to show a short video. This is Joey. You go back to the information I presented, the SIP scores, and kind of that conception of who you think he is based on the information that I provided. He's going to give us, he did a video, so he's going to explain to us who he thinks, who he is, and as he presents himself as a person. So hopefully we can kind of think about how he feels his strengths are and what he feels like as a person. And then we can kind of try to match up what our kind of conception of what of who he was based on the information. So let me try to do this and not lose anybody. So I'm going to stop this. And then I am going to share. Let's see. It is paused.
New share.
New share. I don't know. Suzanne, can you pull it
Yeah,
up?
I can. If you stop sharing, I will
Okay.
share.
All right.
But you've got to stop sharing first.
Share.
All right. Stop share.
Yeah.
Okay. Got it. Thank you.
All right, here
I
it
like the
comes.
technical help.
Yeah, and we've got just enough time for this, and we're going to have to wrap it up. We're running out of time.
Right.
Okay, so here we go. Oh, just a sec. Okay, hopefully, let me know if you can hear it. Can you hear? Cannot hear.
No.
Okay. All right, then I'm going to share a different one. So just a second. I've got.
Suzanne, do you need to do the Zoom audio?
Yeah, I've got it. I've got it right here. Hang on just a second. I just couldn't do it in that format, but here we are. Okay.
Hello, I am Joey. I am a young man with autism who does not use speech to communicate. I am able to communicate best when I am typing. My speech does not match my real intelligence. I am very distracted by meaningless things. I can't control my body or emotions. This makes me look retarded. Understanding things and not being able to talk is very frustrating. My thinking is so much more than some think. Movement is like moving the mountain with a spoon. I am trying so hard to control all that is happening, and you see how it can't happen. My movements come from cues and road moving. When I am in an environment, I am always looking for order. In need things to be in a certain way. I am not wanting things to be chaos. I want order. My body just does this out of need. It is also about the relationship you have with the other person. Each of us are trying to be more when we are together. The relationship is to expect each individual to have a want to be together and know the real me. Each of us want to be accepted. We want people to know that we are listening, and we want to be included, but our bodies don't cooperate. Please think about learning to know more about movement and communication. They work together, and my ability to be the person I am is dependent on you thinking this is possible.
So lovely.
So I just want to reemphasize that really it is about believing in the kids that we work with and making that a priority in terms of how we treat and what we would like to see happen in terms of our our interaction style. So I just wanted to, this is our information. We just wanted to put it up there. And I know Roseanne has things to say, and hopefully we'll have a little bit of time to take questions if you have questions. So we wanted to say thank you and appreciate the invitation.
Yes, thank you so much for the opportunity.
Thank you.
Thank you both so much. So, well, let's go to Roseanne. So we give her a little time and then we'll see if we have any time for some of the questions.
Thank you. What a beautiful presentation, Richard and Aparna. I really enjoyed, and you gave us so many pearls. I'm just going to highlight a few. I love, Richard, you talk about, I'll call it the therapist factor, but you so eloquently, I think, explained the importance of the therapeutic alliance between the therapist and the child, which is really hard to develop. You make it seem easy, but it really is something that is takes skill, and it takes the ability to read the child and insight into yourself as well. And I just was so impressed with how you were able to articulate the importance of understanding the client as a person first, and emphasizing that in the therapeutic interaction. And I just wanted to say that that's one of the important steps in data-driven decision-making as well. You know, our kind of systematic approach to air sensory integration, it's the very first step, is learn who the child is, or the person, the client is, and identify their strengths so that you can bring them into the treatment approach. So it was really nice. And you also said, how do I organize myself as a therapist, and how do I organize the environment, Aparna, to best meet that client's needs? And again, I just think it was extremely important that you highlighted this. And I loved the idea of the dance as well, because we talk a lot in our studies. I mean, Zoe can also talk about this, but this is what we see evolve in our therapists when we're working with them in the studies, is that in the beginning, it's kind of clumsy. It's this clumsy little dance that nobody knows who's leading. And then very quickly, really, it becomes this kind of synchronous experience where the therapist and the child and the parents even are all interacting in synchrony. And it is, we see this dance come alive in our studies when we're working with the therapist as well. Aparna, I loved your idea about the narrated feedback as well, and how important that is. And I think we saw that in your video, Richard, with Joey, that, it is important that you give the client the opportunity as well to experience the narration that you're helping them identify. And Aparna, your presentation also made me think about something that we use in our treatment studies, which is a little like acronym, if you will, that says put the goals in your head, the activities in your pocket, and fun in your heart. And it's sort of like what you were talking about, with developing this co-regulation with the children, and finding the equipment and activities that allow you to address their needs, having some things in your pocket, but needing to be flexible based on what you're presented with the client that day. And then, the importance of play, both of you spoke to that, how important it is to be playful. And, we recognize that in our studies, but also in the neuroscience literature, it's very clear that neuroplasticity, which is one of the things we're after in this approach, is facilitated by playful experiences. I put some sources in the chat box for people if you want to learn more. We do have an advanced practice certificate in autism that helps therapists develop more sophistication in their skills when dealing with children that have, challenges that are greater than what we might usually see in children. and some learning modules. And also you can go to our website and read a little bit more about our studies. And lastly, Aparna, I'll just say that I love your little washing machine. And I have a song that goes with it.
Oh, I love that.
You gotta do it, Rose.
I
I'm
do.
not gonna
Here
do
it
it tonight.
comes.
You
Here
have
it
to get
comes.
me in the right frame of mind. So but the point is, you make it fun, right? We have a fun song that goes with that. Yeah. So I want to thank everybody. This was really, truly inspiring. Thank you for the work that you're doing. And thank you to Classy for including me in this webinar tonight. Thank you so much to everyone.
Thank you so much, Roseanne and Richard and Aparna. That was just fantastic. I think that a number of the questions that were being asked early in the session were probably answered as you went along. You know, I'm thinking about, Richard, your background in psychology, and Dr. Era's background as a psychologist. And, you know, she worked so hard to help us to try to put ourselves in the place of the child. And I think that both of you tonight have just reminded us, you know, to kind of step out of our own anxieties and stresses and insecurities and try to imagine what life might be like, what the challenges might be like. You know, sometimes I think we're very hard on ourselves and in judging ourselves, but you offered us such great questions to reflect on. There's a more recent question in the Q&A, and I'm wondering, Richard, if you might have something specific that might be helpful here. There's a question about how to manage some of the pressure that comes from other disciplines in relation to encouraging children and our patients to communicate in a socially appropriate way. So I know that you've walked that line. I wonder if you have something you'd like to.
I'm not sure if you're referring to ABA or not, but you know, I think that in terms of appropriate social communication, you know, I've been hit, I've been, you know, bitten, I pretty much everything. And, you know, I have to take and understand why. Okay. So if I'm doing something that's my fault, I'm going to tell the child, I said, look, okay, you're right. I deserve that because this was making you upset and I wasn't paying attention. Okay. So you got my attention, you did that. Can we think of a different way so that I don't hurt so much by you letting me know? So, you know, instead of hitting me, then how about just tap me on the shoulder? So I think that there has to be a driving force behind communication. And, you know, pretty much all my nonverbal kids communicate quite effectively. And I've learned that they do that very well. And my job, I think, as a therapist is to then help guide them in a more, or how about a less hurtful way to me, but to recognize, okay, you're frustrated, and I also do the feedback in terms of what I'm trying to understand. So I'm not going to drill a kid in terms of social communication. I'm going to accept the communication that that child offers. And through the sessions, I'm going to help try to facilitate more socially acceptable types of communication.
You know, Richard, the other day you were talking about this and you said that you would, when you found out that the children really loved all that pressure, that you preferred to figure out many ways to give pressure so they didn't escalate to what's considered negative behavior, aggressive or self-injurious behavior. So if you could cut that off at the pass, it really reduced those more egregious kind of actions that might hurt somebody or themselves.
Yeah, and I mean, I think that you know, that's kind of when you see, I think the example I was going, one of my guys came in, he was not doing good that day, and he likes deep pressure, but he doesn't necessarily like it from a person initially. So he went on the trampoline. We have heavy mats. He went on. I threw the mats up on the trampoline. He burrowed underneath the heavy mats. I turned the lights out, and I gave him 10, 15 minutes. And I just, okay, just let me know when you're ready to start. And if you need more time, that's fine. So he wasn't going to be aggressive to me, but I could tell from his body language that he needed a break. He needed to take time for himself. And so I think that's the same thing as when we meet our kids, we see them for that day and we see what they need for that day. And then we as therapists adapt and help facilitate that, the calming or the alerting or whatever it is that they need for that day.
Yeah, and I also, just because we only have 1 minute, Richard.
Sorry.
So I just want to say that in working with Aparna, we've been so privileged at Centerpoint to have Aparna there as well. And you know, you're always putting voice to, like, oh, friend, I see that you want to go into that closed door where Suzanne is testing.
Yes, that's a true story.
Yeah, but I just love the way you put voice to, you know, I know you're frustrated that there's a barrier here. What can we do? How can we go around it? Maybe we could knock on the door. And so finding solutions to those frustrations, and then just ever so gently expanding out on the repertoire of these children that have such a hard time with change and boundaries.
I think it really helps them to feel heard, right?
Yeah.
And understood. And that's
Well, that's an excellent conclusion to our webinar. Oh,
I'm
really?
sorry, can I ask Roseanne one question?
Yeah.
Because I think this is important. And I don't know if you're finding it in your studies, and I don't know if you can talk about it yet, but have we started to see changes in behavior with those studies?
Well, you know, the first study is done and we saw great changes in the children and behaviors. And as importantly, we heard from the parents about how the children were more able to participate and interact in their everyday life, which, you know, is really what it's all about for these kids and families. And in the second study, you know, we're not really allowed to look at the data yet, but we do talk with parents, you know, and hear what parents have to say and we watch the videos with the therapists. So it's nice that we see the children changing. Now, whether or not, you know, in the second study, we're comparing it to ABA.
Mhm.
So we don't know if the kids do better in SI, ASI than ABA. And there's probably going to be some kids who do better in different approaches. And we hope to be able to tease that apart. But, you know, I think the best barometer is what people are seeing in their everyday practice and being able to capture that in not only our clients, but also in the families and the lives they lead in their lives, within their moments of lives. And that's what we hear becomes so much easier for everyone, families and clients. I'm sure you see that with your older clients as well, Richard, that lives just become easier. And I think it's so important. I put this in the chat box, but I'll just say it out loud. What you said about, you know, honoring our clients and finding ways to honor them without hurting them. It's so important. And we're hearing autistic persons who can now learn to communicate, and they're talking about how they didn't feel that some of the treatment that they got was honoring of them. And so I think this is a really important point that we sometimes don't articulate enough as persons who are using air sensory integration. So it's also a way, I think, to measure that we are helping.
Right, thanks.
Well, thank you all so much. This has been absolutely wonderful. And So check out the resources at Thomas Jefferson University. Roseanne's got an amazing program and a line of research, and Southpaw has amazing equipment. And Classy, we've got other educational programs. We've got other webinars available to you. But don't go away. So are you going to make the announcement on our
Well,
winners?
how do we know who the winners are?
Because I have it right here.
Okay.
I'm gonna share my
Because
screen really
we
quick.
have-
Yeah.
Okay, Melissa
Okay,
has it.
And
Thank
then
you.
you guys can announce the winners.
Okay, the winners of the Southpaw equipment, it is Stacy Chang. You are the winner.
But
Okay, the winner of the Easy Starter Kit is Cherise Martha Leba. Leba? All right, congratulations to
Yay,
everyone.
Thank you, everyone. Thank you for a beautiful presentation and a really thoughtful evening, and to all of our participants for joining us. It's wonderful to see your comments. We'll be back, and thank you, Southpaw, so much for your support.
And the winners, this is a detail, you can email Melissa and she's going to put her address in the chat box.
Yeah.
Okay, so get a hold of Classy and we'll make sure you get your prizes. Thank you, everybody. We hope
I just have one logistical question. People are asking if they will see the chat on the replay.
They will.
They will. Good. Okay. So there you
They
have it.
will, and we'll be back August 10th, right, Suzanne? Yeah.
Okay.
It'll be posted.
We'll be
in my
sharing
folder.
that information, but thank you all so much. It was really a great night.
Thank you, everyone.
Thank you.
Night.
Thank you,
Okay,
Richard.
you.
good night.
Let's see, Melissa, do you want to
Yeah.
stop the recording? And
Yes.
thank you.
I just stopped the live stream and then we'll stop the recording.
Oh, Katie said she doesn't think they see the chat. Maybe they,